Bismillahirrahmanirrahim. Started with the name of Almighty Allah, the most beneficent and most merciful. We have started the topic of introduction to medicinal chemistry, and I did talk to you. This is the entire game about the health sciences. The integral part is the pharmacist. In the center is placed, and here is the clinician, and here is the nurse. Now, then I did mention to you about its definition, and I did talk to you the definition. It's a branch of chemistry that deals with the biochemical pathways through which drugs produces their beneficial effect. Now, in the introduction, the most important aspect which currently have been incorporated into it, and that is very crucial aspect which you have ever studied in this respect. Introduction to medicinal chemistry case study. This is the latest thing which has been incorporated in FOIS. And I did talk to you, I love FOIS in a way, it provides you the knowledge of biology plus chemistry and give you the most authenticated ways to explore the cases and how does we could be able to reach to the efficacious and therapeutic, effective and efficacious and least toxic drug. And in that respect, introduction to medicinal chemistry, particularly with reference to case studies we will be dealing. And in that respect, here is that one. We are pleased to share our newest medicinal chemistry case study with student and faculty users of FOIS, Principles of Medicinal Chemistry. One case study is provided at the end of most chapters. So now I'll explain it to you why one case study has been mentioned in the end of the chapter, because each chapter in this book is specific, and that is deals with the cardiovascular drug. One chapter deal, another chapter will deal the kidney, another chapter will deal gastrointestinal drugs, another chapter will deal other kinds of drug products. So at the end of every chapter there is specific case. You have to specialize, and clinician will specialize. This is cardiovascular disease, this is gastrointestinal disease, this is area in which the eye disease is there, and the pharmacist should have to select the pretty good drug, particularly with reference to cardiovascular effect, with reference to gastrointestinal effect, and with reference to eye, and so forth. That's why this has been mentioned. One case study is provided at the end of the most chapter. This preface is written to explain their scope and purpose and to help those who are unfamiliar with our technique of illustrating the therapeutic relevance of chemistry, get the most out of the exercise. Therapeutic relevance is the important issue, particularly for pharmacists. Like the most familiar therapeutic case studies, medicinal chemistry case study are clinical scenario that presents a patient in need of a pharmacist's expertise intervention. The learner most commonly in the role of the pharmacist evaluate the patient's clinical and personal situation and makes a drug product selection from a limited number of therapeutic choices. Now, here you can understand the relevance of drug choice is the actual domain of the pharmacist. There are, say, if there is a case of cardiovascular disease and patient is in front of you, and clinician is also there, and nurse is also standing there, and you should have to select what drug should be given to this patient, who is a patient of heart. There are multiple other diseases to this patient along with the heart. He might be diabetic, he might be having glaucoma, and so forth. And you should have to select most appropriate drug which is relevance to the case study and to that particular patient to whom you are going to administer would be effective. That means most effective and least toxic drug should be administered to the patient, and this is the task of a pharmacist. That's why I am sharing these things with you, so that you must know what is medicinal chemistry, and this is the domain of medicinal chemistry, wherein you should have to add ADME with T, that means absorption, distribution, metabolism and excretion. This part will cover the therapeutic efficacy, and the T will cover toxicity. Most therapeutically effective and least toxic is the domain of pharmacists. For that matter, we spent 5 years to the pharmacist to let him to know these 2-3 words. Most therapeutic efficacious and least toxic drugs should be administered into the patient. Limited number of therapeutic choices. However, in a medicinal chemistry case study, only the structure of potential therapeutic candidates are given. To make their professional recommendation, students must conduct a thorough analysis of key structure-activity relationship in order to predict such things as relative potency, receptor selectivity, duration of action, and potential for adverse reactions. Now, here is you can see, that is, you have to look into it. This is the receptor, talking about the receptor selectivity. Receptor selectivity, here is the receptor, and then you should have to select the drug. That should be, in a way, it should be administered here, and it should catch up in a way as I am performing it. This is lock and key mechanism. This is lock, which is a receptor, and this is the key. You have to open the receptor with the key, and when these things will adhere herein, the receptor would be appropriate and it would be bound to the drug, and the elicitation of the drug response would be therein. And then you should have to know duration of action, which is also important. How long it will act and how it will act, the T have, and so forth would be known to you. And potential for adverse reaction. That's why I am again always used to go towards the ADME with T. You can say the structure-activity relationship. Looking to the structure, you would see how it will absorb into the body, and you would see with the structure what way it will distribute in it, and now then you will look into it how it will be metabolized, and then you will frame up what will be the route of excretion. So these 1, 2, 3, 4 words would let you to know a point which is called as therapeutic efficacy, and then there is T, which relates toxicity, therapeutic efficacy, toxicity. These are the two important things which are being framed up in a way so that you should know the drug for a patient who is in front of you. Say this is the case of cardiovascular disease, and you should know, knowing this, each class of drug, you must know about its absorption, distribution, metabolism and excretion, and along with that toxicity. Then you can select the most therapeutic efficacious drug with the least toxicity. That is the domain of a pharmacist. That's why I used to say to you people, you have got very good frame of work in the health sciences. In the center you have been placed, because the clinician has to let you to know, here is the prescription I am writing for the patient, and you have to know by emphasizing the knowledge of Adami with T, whether this drug for cardiovascular disease is good, this drug is good or this drug is good, or combination of drug is good, or one drug with this is being good. In this respect, you should have to select, and this is the domain of a pharmacist. And if pharmacist must know it, then he is a pharmacist. And you should be in a way that you should be knowing the absorption, distribution, metabolism and excretion of every drug of each class, and along with that you must know the toxicity. Then you can do whatsoever you like, and I can let you to know. If you would be knowing all these things, clinician / doctor will salute you, nurse will also salute you, and this is your domain wherein you should have to select most therapeutic efficacious drugs, knowing its absorption, distribution, metabolism and excretion, and the least toxic one, so that the patient should be in a right place of health, and patient should be let it to be correct as it should be. And this is the actual domain of a pharmacist. Students must conduct a thorough analysis of key structure-activity relationship. That means key structure-activity relationship of all cardiovascular diseases, drugs, all gastrointestinal disorders, drugs, all series of eye drugs, all series of kidney drugs, all series of other kind of drugs which are needed. Knowing this, you can be very good pharmacist in order to predict such things as relative potency, receptor selectivity, duration of action and potential for adverse. These things are keywords for you, and you must know these things, and then you can apply a pretty good drug so that the patient should effectively be cured, and he will be very thankful to you, as well as clinician or doctor and as well as nurse would very likely love you in a lot if you would be knowing these things on your hands, and all the time if you would be having these things in your mind. And if I can give you the little bit tidbit of it, if you are not following it, what you can say, please let me go for a while, I'm coming back. You can go anywhere and you can click to your mobile and you can check all these things and you can discuss, no problem at all. You can do it, but you must do it prior to the administration of a drug to the patient. Right case study would be there and right drug should be administered. No false study case would be there and no false drug should be administered. You should have to think many times prior to administering the drug, and it is the teamwork in which 3 persons are involved: pharmacist, clinician, doctor or nurse. All these are the framework of health science. The therapeutic choice we offer in each case have been purposefully selected to allow students to review the therapeutically relevant chemistry of different classes. This is the same thing which I am just explaining it to you. Therapeutically relevant chemistry of different classes of drugs. As I did mention to you, cardiovascular drug, gastrointestinal drug, kidney drug, lungs drug, eye drug and so on and so forth, used to treat particular disease. You should know the structure of each drug of each class effectively, so that you should be knowing about it. Admi-T. We recognize that this approach might occasionally omit some compounds viewed by practitioners as drug of choice within a class or the formulary entry at their practice site. This is the point wherein clinician would not be knowing, and you should have to let him to know, okay, this is that one which we have to administer and this is that one which we not administer. Faculty employing the cases as in class or take home assignments might alter the structural choice provided to meet their teaching and learning goals, and this is certainly acceptable. Regardless of how they are used, students working thoroughly and scientifically through the case will not only master chemical concept and principles and reinforce basic SAR. Again, you should have to look into it, but also learn how to actively use their unique knowledge of drug chemistry when thinking critically about patient care. This is your domain. I did talk to you a right case study and right drug at right time in the presence of clinician or doctor and nurse should be administered so that the patient should be cured. That is the domain. But also learn how to actively use their unique knowledge of drug chemistry when thinking critically about patient care. This skill will be invaluable when a practitioners they are faced with the full gamut of therapeutic options to analyze in order to ensure the best therapeutic outcomes for their patients. This is the thing. Next. In short, there is what we hope student will gain by working on case. Number one, mastery of the important concept needed to be successfully in the medicinal chemistry component of the pharmacy curriculum. That is medicinal chemistry. Number two, an ability to identify the relevance of drug chemistry to pharmacological action and therapeutic utility, and to discriminate between therapeutic options based on that understanding. Number three, an enhanced ability to think critically and scientifically about the drug use. Very, very important aspect of it. That is the key wherein pharmacist has to utilize his mind and let the patient to be cured. I can think that sole authority in this respect is the pharmacist. A commitment to caring about the impact of professional decision on patients' quality of life. The last one, but not the least one, the ability to demonstrate the unique role of the pharmacist as the chemist of the health care team. Again, I am here emphasizing my son and daughters, the ability to demonstrate the unique role of the pharmacist as the chemist of the healthcare team. Now, this is the healthcare team, and among them, you are here, and you are the sole authority of the team. And being a team head, you should have to decide what drug should be given. If you should be knowing all the drugs in each class and their structure and their ADME along with the T, then you can guide to him, guide to her as well. And there will be your name like twinkling stars on the sky. And I wanted it should be like there, and मगर इसमें लगती है मेहनत ज़्यादा. पढ़ोगे, लिखोगे, बनोगे नवाब, खेलोगे, कूदोगे, होगे खराब. तुंदी बाद मुखालिफ से ना घबरा ए उकाब, ये तो चलती है तुझे ऊंचा उड़ाने के लिए. तो तुंदी बाद मुखालिफ यही है कि you have to know, being a pharmacist, class of drugs, their structures, and each structure with relevance to Adami with T, then you can decide that this is the patient, this has got many multiple diseases in the body, and what disease is being treated, and what kind of drug in that respect should be selected, as other drugs are also being administered to the patient for his or her survival. Thank you very much, my son and daughter, in that respect. Now, I would like you to give little bit of the syllabus outline, which we will be sharing in the current year. Now, this is the final professional class, pharmaceutical chemistry, 7th paper, Medicinal Chemistry Theory. The topic will be taught with special reference to their pharmaceutical application in this number 1, Introduction to Medicinal Chemistry. So I have provided you the introduction up till now within 2 classes. In this respect, I did talk to you, being a pharmacist, what is your domain? Your domain is to select very effective, therapeutic, efficacious and least toxic drug to the patient for his or her survival. Now then, again, chemical constituent and biological activity, receptor theory, structure activity relationship and drug metabolism we will be discussing in that aspect. GBT. Now the next is modern concept of rational drug design, pro-drug, combinatorial chemistry and computer-aided drug design and concept of antisense molecule. Now number 2, drug targets and drug design. A, introduction and type of drug targets. B, introduction to molecular modeling and computational chemistry. C, structure-based designing. D, legend-based designing. E, various technique in drug synthesis. Number 3, the major part of it which we will be sharing during this academic session, general properties, chemistry, biological actions, structure activity relationship and the therapeutic applications of the following. Under this is the list. I am going to let it you to narrate for you. A, hormones. Under hormones, there are 2 kinds of hormones, steroidal and non-steroidal hormones. Under steroidal hormone, we will be sharing testosterone, progesterone, estrogen, aldosterone and cortisol. And under the non-steroidal hormone, that is the proteinous hormone, that is included insulin, glucagon, oxytocin and vasopressin. B, anti-neoplastic agent. Under anti-neoplastic agent, we will be sharing tamoxifen, fluorouracil, mercaptomurine, methotrexate and vincristine, natural alkaloids. C, sedative and hypnotics. Under sedative and hypnotics are included benzodiazepine, barbiturates, paraldehyde, glutathamide, chloral hydrate and alcohol. D, anesthetics. Under anesthetics we will be sharing local anesthetics. Under local anesthetics are included procaine, lignocaine, eucaine, cocaine and benzocaine. General anesthetics included cyclopropane, halothane, nitrous oxide, chloroform, thiopentyl, sodium, ketamine, methoxylate, thioamyl, sodium, phenytyl citrate, tribromoethanol. Then E, analgesics and antipyretic agents. Under that are included paracetamol, salicylic acid, analogs, quinoline's derivatives, parazolone and parazolidine, N-aryl anthranilic acid, aryl and heteroaryl acetic acid derivatives. F, sulfonamides. Under sulfonamides are included prontosil, sulfanilamide, sulfapyridine, sulfadiamidine, sulfamethoxazole, sulfadiazine and sulfafurazole. G, antimalarials. Under antimalarials are included 4 aminoquinolines, 8 aminoquinoline, 9 amino derivative acridines, butyrienes, pyrimidines, analogs, mefloquine and cinchona alkaloid, which is a natural alkaloid, and H, there is diuretics. Under diuretics we will be sharing mercaptomurine, meruloride, thiazide, spironolactone, theophylline, furosemide, acetazolamide, ethacrylic acid and triamiterene. Then I, antitubercular agent. Under that are included ethambutol, isonicotinic acid, hydrazide, rifampicin, thiaguanine, pyrazidine, cycloserine, ethanamide, cytarabine, 5-fluorouracil and decarabine, Then antiviral drugs. Under antiviral drugs are included acyclovir, trometazine hydrochloride, and ribavirin. K. Immunosuppressive agents, azathioprine and cyclosporine are included in it. Then the last and least in this respect, antibiotics. Under the antibiotics are included penicillin, cephalosporin, streptomycin, chlorphenicol, tetracycline, kanamycin and erythromycin. Thank you very much, my son and daughters. And again, I would like you to say that my mobile number is 030041630075. You can talk to me anytime, any moment, anywhere, and I will be there and for you to help out. Thank you very much. So nice of you, but love, thanks. If you like to ask anything, don't hesitate to ask it. Allah Hafiz, fi aman Allah.